Here's the situation. An increasing number of cancer patients are now opting for naturopathic treatments in addition to or in place of conventional treatments like chemotherapy. A recent study analyzed data from nearly 2 million patients in the United States and concluded that 34% of patients taking naturopathic treatments refused chemotherapy. Compare that to only 3% in the group of patients who were receiving conventional care. The 5-year survival rate of the group seeking alternative treatment was 82%. This is 5% less than the 87% survival rate among those who opted for conventional treatment. These results suggest that the higher mortality rate associated with patients taking naturopathic medicine was associated with the refusal of conventional care. With the increasing prevalence of naturopathic cancer treatments, it's apparent why this is such a pressing concern. We spoke to Britt Hermes, an ex-naturopathic doctor who is now an outspoken critic for naturopathic medicine. We asked her, what does a typical naturopathic treatment plan for a cancer patient look like?
There is no typical treatment plan. The whole shtick of naturopathy is that all treatments are individualized. Now, that being said, there are really common therapies that are used over and over in cancer therapy, and these include really high intravenous doses of vitamin C, special diets, like diets that recommend that the patient don't have any sugar, but then this gets really extreme and is extrapolated into even no fruit sugars, so no fruit, and no simple carbohydrates, so no white flour, for example, and then the use of supplements, which can range from anything that is labeled or marketed as anti-inflammatory, like turmeric, to supplements like intravenous preparations of an herb called mistletoe. What's really appealing to patients, and really I think part of why patients fall prey to naturopathic treatments, is that it's sold to them as an individualized treatment plan. For this type of cancer, we're going to follow protocol XYZ. And if, patient B comes in, the naturopath will say, for your type of cancer, we're going to follow treatment plan ABC. It's really just the same mishmash of non-effective therapies, but it's packaged and marketed in such a way that it feels like it's individualized.
Near the end of that clip, Dr. Hermes mentions the appeal of naturopathic treatments, which begs the question, what is it exactly about these treatments that appeals to patients so much? Research has suggested that patients who are feeling hopeless or out of control of their situation tend to turn towards alternative and naturopathic treatments. Also, a lot of these treatments are sold as being able to ease the side effects of conventional treatments like chemotherapy.
The pitfalls of naturopathy therapy are that most therapies have not been fully tested to see if they're safe. We don't know that they are not interfering with the conventional treatments. So there is some evidence that suggests, for example, that high doses of antioxidants like vitamin C can perhaps lead to worse outcomes for patients who are receiving chemotherapy.
Now, if that's the case, patients are using their time, money, and resources on unproven treatments, and they're potentially running out of time to pursue effective conventional treatments like chemotherapy. That being said, what about those patients that are pursuing both? They're pursuing naturopathic along with conventional treatments.
I know a lot of therapies are sold as being able to mitigate treatments. And to go back to the intravenous vitamin C one again, this is another one that is sold as also mitigating chemo side effects, because it's supposed to, help clear the chemo out of your system faster, which, if you think about for a second, doesn't make sense and isn't actually what you want to happen. That chemo is going through your system and affecting the cells at whatever molecular level it's being targeted for a reason. You don't want to necessarily clear that medicine out of your system.
With all that being said, is there a middle ground? Is there an optimal combination of naturopathic and conventional treatments that can be used to yield the best possible outcome for patients? We've barely just scratched the surface behind the science of integrative oncology in this video. Tune in to #NaturalCancerCures on the #Health Podcast to hear the full story.